Yes, hello everyone. This is Dr. Khan, Executive Plastic Surgery, Bloomfield Hills, Michigan. So as you will see, 100% total capsulectomy, 4/9/2025, initials NK. A set of implants, 1990, according to the patient, what are saline implants below the muscle, just one set. So these are your 35-year-old set of implants. I did a lot of contouring on her. As you can see, I removed a lot of this tissue, especially on the side. That really helps with the contouring. She had the relatively small implant on the right side, as you can see, and on the left side you can see there's like some dark matter on the inside. So I'm just curious to see what that is eventually. So on the right side, with my sterile gloves, I'm going to go ahead and open this up, and so we will see what is there to see. So this is very much, as you can see, look at the way the implant is sitting. It's like oval shaped, just like football shaped. Very interesting. So if I go like this, let me go ahead and get this, what is this, slime around. If I go like this, you can see, look at this. And if you look at how this implant is sitting, oval shaped, and guess what? If I'm going to press over here, you're going to see it's going to spread out. You can see this seam right here. I'm actually going to press this out. Watch your eyes. There you go. Look at this, how it was compressed together. And I just want to spread it out. Look at this dark matter right here on this side. Here on the inside it has, I'm actually going to take cultures of this here, this piece. Very interesting. I'm going to split this open. This is officially what is an intact implant. It says 200 over here, 200. And look at this yellow and then this dark brown matter right here. I'm going to split this open right here. So, and it's going to spread out. So what is an intact implant underneath? So if I press this out, you can see how it's kind of shriveled up on itself. It's like it was contracted into a football. So intact implant, and I'm going to go ahead and take some representative samples of this matters because we need to roll out fungus, as you can see right here. What I'm going to do is I'm going to go ahead and look inside here. Look at this. This part of this is the bovic cautery on the outside, but let me go in on the inside. You will see this is where the capsule is going to go to pathology. Complete 100% total capsule removal. As you can see, very thin area. So nothing out of the ordinary, no masses that I feel or palpate right here. So very interesting. I'm going to go ahead and move this tissue here. I'm going to now remove, I'm going to send this along with this. I'm going to now remove my top glove because I don't want to cross-contaminate this into that. I see some surgeons use the same gloves, non-sterile gloves. I don't like that. They should use a brand new set of sterile gloves. Again, full thickness skin, as you can see right here for the contouring. And as I go in, a lot of inflamed tissue. So look at the color of this. So this is now the answers a lot of questions here. So look at this. So this is what you call saline plus silicone implant. So this is what is a ruptured implant, and in the periphery they have betadine on the outside, and this is your 240cc implant. So the saline implant, they put betadine in this, and on the so this is basically composed of, if you will, two balls, if you will. The inside is the silicone, and the outside is the saline right here. And this is where they put betadine, and that's why you're seeing that color. And this one appears to have ruptured. That's why you see how it's collapsed on itself. And over here, this is your McGann 240cc implant with the outer side where the betadine is still very much preserved. And that's why it gives you that dark appearance. So that kind of helps answer that question. So that's betadine residue. Nonetheless, we're going to see overall I'm very happy and content. So a lot of tissue that was inflamed, that was removed, and all of this capsular tissue, very thin along with that inflamed tissue, was removed. And so there you have it. What's interesting about this patient is she has a betadine allergy. So when I asked her what drug allergies does she have, she said betadine allergy. And so I documented that, and I let the staff know we were not going to use the betadine on her. And what's interesting is she has had the betadine in her all along. And so very, very interesting. So the implants will be returned to the patient. Capsules will be sent to pathology, rule out the BIA, LCL, CD30 analysis, rule out lymphoma, rule out malignancy, rule out abdominal pathology, cultures for aerobic, anaerobic, and fungus, just to be complete, which is what I do on all my patients. And she's got a very nice aesthetic contouring of the left and the right side that she's going to match. Given the distance from the nipple all the way down to the crease is going to be equal on both. And I'm very happy. The blood loss was less than 5 cc's. I'm very happy how this nice 65-year-old lady recoiled, given the level of contouring I did. This implant on the right side is indeed very much ruptured with the betadine that actually leaked out. Now remember, those surgeons in the past that used to put betadine within the saline implant, it is contraindicated by the manufacturers because it distorts or basically disturbs the chemistry of the saline implant, the silicone shell of that saline implant. So it's contraindicated, not recommended by the manufacturers. So there you have it. You never know what you're going to find. You know, here's this dark matter, if you will. You can focus on this, Emily. So here's the dark matter, and look at this one over here with the silicone inner part and the outer saline part that has ruptured, and you see the residue of what is suggestive of the betadine. So there you have it. This is Dr. Khan, Executive Plastic Surgery.